Thanks for joining us as we paint a drug picture of the ADH related drugs, the pressins. Vasopressin, Desmopressin, terlipressin, terlipressin, and other drugs that end in the suffix pressin are ADH, or in other words, antidiuretic hormone-related drugs. Antidiuretic hormone is also called ADH or vasopressin, and it is nicknamed the water saver. This is a really interesting drug group because normally our drug groups are used for basically the same thing. But in this case, vasopressin and desmopressin are used for people who have a lack of their own ADH or vasopressin. And because the terlipressin and terlipressin only affect one of the three subsets of ADH receptors, they are used for a completely different reason. And specifically, terlipressin and terlipressin are used for the vasoconstrictive actions. So let's take a look at why these drugs are so similar yet so different. When the hypothalamus determines that we need more fluid in the body, and we determine that by increased osmolarity, the hypothalamus signals for the release of ADH, or it's also called vasopressin, and it's also nicknamed the water saver. So the vasopressin or water saver or the ADH actually goes down to the level of the kidneys, and it affects the receptors on the distal convoluted tubules. And there the action of vasopressin is to open up water channels at the level of the kidneys, at the level of the nephron, and that allows more water to go from the urine, basically the pre-urine, back into the blood. So the problem is solved. Now we have more water in the body. The osmolarity decreases and the hypothalamus is happy. The selective receptor that's on the kidneys, on the nephron in the kidneys, is called the V or vasopressin 2 receptor. Vasopressin and desmopressin affect that receptor. So vasopressin and desmopressin are great in times of ADH or antidiuretic hormone insufficiency. That disorder is called diabetes insipidus. And with diabetes insipidus, if you don't have that medication, the person will die of dehydration because they're not saving enough water. So let's leave that V2 receptor alone for a while, and let's go back up the hypothalamus and think about the hypothalamus. It was actually determining basically that we didn't have enough fluids. And in our evolutionary development, when we make a hormone, we pretty much try to get that hormone to do as many things as possible to help out the situation. And in this instance, we had ADH not only work at the level of the kidneys, but also there was a selective receptor called a V1A developed on blood vessels to constrict them, just in case we weren't getting enough fluid back. We're going to constrict the blood vessels at the same time. So the ADH has a selective receptor called the V1A receptor. And terlipressin and terlipressin are examples of drugs that affect that receptor, the V1A receptor. They actually just constrict the blood vessels. So they're great in time of constricting blood vessels when there's a surgery and there's too much of a loss of blood happening, or if it's an emergency accident. In those types of emergency situations, they're very good. Most of the pressin drugs are administered by injection, although sublingual and nasal sprays are also available for some of those drugs. Desmopressin is a synthetic analog of vasopressin, and it requires less frequent administration. But this also has another use, so there's another level of complexity to this group of pressin drugs. Desmopressin is the one drug that can be used outside that ADH insufficiency or hospital setting type of situation. Desmopressin can be used for people who have nocturia, or in other words, nighttime urination, and for people who have bedwetting problems. So what happens is that the person takes the desmopressin at nighttime, and as they go through the night, they will be retaining their fluids until the morning. So that is good for bedwetting. But I do want to mention something that's very important, because all through that time that they're saving the water, it's a water saver. ADH is a water saver. It saves water. It doesn't save electrolytes. So the kidneys are still working there. They're putting out the sodium, and they're excreting they're trying to excrete the sodium. The problem is that if somebody actually goes into that nighttime period, takes their desmopressin, and has been perhaps a little bit dehydrated through the day because it's been a very hot day and they've been sweating, or because they've been doing strenuous exercise, that could be a problem. They could develop hyponatremia, and that can be a life-threatening situation.